Ischiorectal fossa or Ischioanal fossa, you might think this is very confusing to be remember, like to remember and draw in the image in exam, and this is also a very important topic for the exams also and clinically also. All right, so this is the Ischiorectal fossa. You can see there are two halves, and we have like a detailed image in a single half of the image. Now in the right side, we'll be trying to make exactly like that, but in a very convenient way. All right, so let's begin drawing. Grab another piece of white paper and let's begin. So first of all, we will be making lateral wall. All right, so this right here is lateral wall, and this is obturator internus muscle. All right, so there will be ischial tuberosity working on it as the lateral wall also. So this is ischial tuberosity, and the fascia covering this obturator internus muscle will be obturator fascia, obviously. That is how we complete our lateral wall. And now let's talk about the medial wall. So medial wall, this is the medial wall, and the muscle is levator ani muscle, and there will be another muscle working on that. This muscle is external sphincter. All right, so that is external sphincter, and there will be the fascia like this of the levator ani muscle, and that is called levator fascia, to remember in an easy way, or fascia of levator ani if you have confusion, to remember like that. So there will be another fascia of this external sphincter muscle, that is external sphincter fascia. That is how we complete our medial wall. All right, so you might get confused here that this levator ani muscle should be superior wall. All right, so but that does not occur like that in reality. In reality, there will be for this image is just for the convenience, right? So these structures align together to form medial wall in the reality. So that is why we are making like that, and there will be this apex by the like binding of medial wall and lateral wall. There has formed a pointed apex in the top, right? So this apex right here is the meeting point of levator fascia and obturator fascia, right? So that is apex. And talking about the base, there will be a skin, and that skin is called perineal skin. We'll be talking about the perineal body or perineal diaphragm later in another video. We'll be talking about that for sure. And then there will be fascia, more fascia to this. This right here is another fascia. This is another fascia. This is another fascia, making connections here and there, hither and thither. All right. So these two fascia combining together will form fascia lunata, right? So that is fascia lunata, and this is another fascia, and that fascia is perianal fascia, and this is a covering making Alcock's canal. That fascia makes Alcock's or pudendal canal. There will be different structures in that, talking about contents later. We'll talk about that. Now that is how the fascia has completed, and that Alcock's canal or pudendal canal is formed by the covering of falciform process of sacrotuberous ligament. We have to remember like that. Then this is just a connection right here. So talking about the spaces, there will be two spaces mainly, and the first of that is this M region, that is ischiorectal fascia, and then the N region, that is perianal fascia. All right, so talking about the contents, the most important parts right now. So there will be a lot of contents. This right here, these three things right here are posterior labile in female, or scrotal in male, artery, vein, and nerve. These three structures pass through ischiorectal fossa. All right. So these three structures right here will be labeled P, and that are inferior rectal, artery, vein, and nerve. Artery, vein, and nerve. Everywhere you have to put artery, vein, and nerve. All right. So there will be this another nerve here. This nerve is perineal branch of S4. All right, so there will be these different regions. These alloy structures are fat. All right, these are the fats. Ischiorectal pad of fat. All right, so these red structures, dotted structures in here, these three structures are the internal sphincter. All right, that is how you have to remember. And this Q region. So We have made the pudendal canal also, or Alcock's canal, like that, and I have put that in a structure right here in the corner. And the contents are obviously radius artery, that is pudendal artery, and vein, and then pudendal nerve. So this is the Alcock's canal, and this is very important to form gain the pudendal block during pregnancy. This is very important, and you have like this ischiorectal pad of fat in a very huge amount in both sides of our buttocks, and that will help to do the defecation, to compress and relax, all right? So that is how ischiorectal fossa will be there, and there will be a connection between ischiorectal pad of fat in two different regions, right and left regions, and thus the infection in one region will spread to the infection in the other side, all right? So that is clinically important, very much important. That is how we cover up these 5 important fossas of our body. So I hope you get it better. I hope I have made it clear, and thank you for staying with me, and please subscribe and share for more like banger videos like this. Thank you.